Yeah, I have two questions. One is for Dr. Haglund. Since we have a little bit more time, could you please tell us a little bit more of your hypothesis regarding the importance of immigration? There is a huge psychiatric literature about the role of immigration in psychopathology. Is it selection? Is it exposure to environmental factors? Which environmental factors have you looked at? I think it's a very interesting area. And the second question I wanted to pose is to Dr. Isaac. Do you think that we are looking at the effect of ART as a technique itself, as some literature would suggest in terms of, for example, epigenetic mismanagement, or do you think that we're simply looking at the increased rate of autism that perhaps we should expect in families that have reproductive problems? So whatever is giving autism in those families is also responsible for reproductive problems. And if you were to study only those families, you would find the same rates of autism as ART. Thank you.
Well, thank you for your question. And this has been a problem for us when we did our study, and we have tried to look back in the literature, and many has suggested different causes of this. But we have still not given any good reason why it is like this. There has been, as I said, the vulnerability for special infections if you move from one country to another. Is there about vitamin D as the latest suggestion? There has not been so many studies according to this suggestion, so we don't know much about it. And one more is about the more environmental. If there is something during the migration itself to the family, are they coming in a special position that is difficult for them to cope? Or is it a special ethnic groups and families that move from one country to another? Is that a possibility? Or is it more in the families that we don't know about the genetics? Is there a more that the father and the mother are more relative that we don't know, because we haven't that data so far. But it's a very challenging question to answer. Thank you.
So, can you bring a microphone to Esther, please?
I think both okay. I think both explanations, either the technology, either the mother fertility problems are available, and further investigation is needed to answer this question. We don't have the answer for this. It's a good question.
Sure, please use the microphone.
Perhaps you said, but I may have missed this point. Is it possible that this relationship you find with the artificial insemination and so on is related to the hormonal treatment that women should?
Microphone, please.
Our sample was with IVF and ICSI. Both of techniques were involved in the cohort. We didn't separate those. All the possibilities are
I have a question for Gianluca Esposito and for Nicole Reinhardt. I was a bit surprised. Do you really think that all the movements, abnormalities that you described are so much isolated from social dysfunctions. Like movement is not just about reflexes, it's also about an intention to act. And you described cerebellar dysfunctions, but I'm sure it's not just about motricity. It's probably about the fact that, for instance, to walk is to walk towards an environment and not just to have reflexes.
Okay, thank you for this question. I do agree with you that motor development it's in some way related with the social development. The point I was raising before is that probably if we do assess motor development in the early stage of life, we could have some hints about some clinical hints that may precede the social or linguistic abnormality. That was the point. So probably the motor development we are looking for in the very beginning, so during the first year of life, such as posture or symmetry in posture, that kind of motor development is in some way unrelated to linguistic and social development.
Thank you. Other questions?
You briefly mentioned about the role of ETG beta 3 in being an extracellular signal influencing possibly translation and so on. Do you have an idea what could be the chain of events that establish a link between this ITGB3 and the serotonin levels? Is this known? I mean, has been investigated? Is it only based on linkage association studies, only on genetic evidences?
Thanks for the question. But this role is under investigation. This is I present only a genetic association between ITGB3 gene and autism risk on biological quantitative endophenotypes. It's important to analyze this aspect because the transporter complex for platelet membrane complex receptor in this case the ITGB3 gene play a critical role. Okay, for this membrane platelet, and my idea this is a possible link in our sample between the ITGB3 gene and immune dysfunction in our sample, okay, in autistic patients detected in our sample. This is a possible link.
I have a question for you. Did you see an association between serotonin and some scores at the ADI or some other clinical symptoms?
Yeah, we detect an association between serotonin transporter gene and the immune-related clinical variables in our autistic patients, especially for the presence of increased frequency of, for example, of food allergies in the autistic patients, but also for autistic immune dysfunction in first-degree relatives. Okay.
But if we forgot, I mean, let's forget the genetics, about the biochemistry, about the level of serotonin.
Yeah, the levels of...
Have you seen some...
Yeah, we found an interesting phenomena because in our autistic sample we found phenomena defined as molecular heterozygosis. In autistic patients, the heterozygous individuals show increased levels of blood serotonin levels. Respect to homozygous for in a sample. This is